Coming up in January, updates to existing insurance laws in New York State will give coverage to millions of people impacted by infertility. So here with more, Barbara Kalura is here, President and CEO of Resolve, and Leah Schuster-Beer, a cancer patient who's looking to save her fertility. So good morning, Barbara. Good morning, Leah. Barbara, how does this important legislation impact changes and impact potential patients like Leah?
Well, we're super excited about this change in New York law. We gathered together a coalition of committed individuals, patients, healthcare providers, nonprofit organizations, pharmaceutical companies like Ferring Pharmaceutical. We advocated in Albany, and New York changed this law starting in January of 2020. If you work for a company and you get insurance coverage, you live in New York, you're now going to have access to IVF, which is infertility treatments, and you're also going to have access to fertility preservation treatments. This is the ability to freeze your sperm or your egg before you go through cancer treatments. Now in New York, starting in January, that'll be covered by insurance.
That's fantastic. And Leah, that really does affect someone like you. You're battling cancer and you're working so hard to preserve your fertility. How are you hoping that this will affect you?
So I'm fortunate in that I'm currently in remission.
Great.
But I was diagnosed with non-Hodgkin's lymphoma 2 years ago, before this law was in effect. As a native New Yorker who did her treatment here in New York, this law would have really helped my husband and me. Instead, we had to cobble resources from our personal savings, a scholarship from Livestrong Foundation, and some insurance coverage, and we were fortunate to make it work. And so we were able to sneak in one cycle before my cancer treatment started. Now, 18 months later, at 31, I am in menopause. And so what makes that less daunting is knowing that we do have frozen eggs and embryos in the freezer. And as soon as is medically blessed by my oncologist, I will be able, with Ben, to start a family.
That is fantastic news, Leah. Best of luck to you and your continued good health. Barbara, tell us how our viewers can get more information about this and what they need to do next.
Yeah, I'm sure your viewers are super excited right now, wondering if they're covered or not. The best thing to do is to talk to your HR department at your company and ask them if they will be under this new law starting in January. Again, it covers IVF and fertility preservation. It impacts different employers in the state, so the best advice is to talk to your employer. You can also contact us and we can help you navigate that process. That's fantastic. Do you have a website you can share with us? Absolutely. You can go to resolve.org. That's resolve.org. You can learn more about this new law in New York and how to talk to your employer, find out if you're covered.
Thank you for this very, very important and really exciting news. And Leah, best of luck to you and your current good health. All right. Thank you, ladies.
Thank you.